I want to talk to you about an exciting new procedure that we've developed, which is called a weekend lift. This is a procedure that I first learned from a great surgeon in Beverly Hills, and we've been innovating on for almost a year now. The procedure is really designed for patients who have heaviness in their lower face, but are not ready yet for a full facelift. These patients are between 30 and 40, they've got laxity, they've got a little bit of, like I said, heaviness in that lower face. And what they need is a procedure that doesn't leave a scar on the front. And patients that I've performed it on before are singers, actors, people in the media. They don't want people to see the signs of surgery. They have a need for an improvement in their jawline. They want to prevent aging and not need a facelift later on. And they may have laxity to the skin or volume issues in the cheek, but not enough that it needs surgery to correct it. This may be coupled with a surgery to improve the upper eyelid shape and to get rid of excess skin that's here, or fat grafting to areas as well. I treat the skin that's above, not the neck, but what's above, with radiofrequency microneedling at the same time. So I utilize a multimodal approach in what we call a weekend lift to give patients a result that helps preserve what they have and prevent the need for a facelift later on. The procedure involves a few key steps. The first is a deep plane neck lift, which is performed through a small incision under the chin, and then an incision that starts just in front of the earlobe and works its way along the back of the ear, but doesn't go into the hairline. This incision allows me to, access the neck, and from this incision to access the neck as well, to tighten the muscles, get rid of fat that's here, and redrape the muscles to recreate a deep jawline and to give patients the tightness that they want in that area. I utilize that approach in order to reset the tension in the lower face and neck. At the same time, I use the radiofrequency microneedling to tighten and thicken the skin and to add collagen to the upper and mid face. Some patients require blepharoplasty, which is surgery to remove excess skin from the upper eyelid or to deal with herniating fat in the lower eyelid to improve the overall shape and heaviness within their eyes. We do this in concert sometimes with fat grafting or nano fat grafting or even fat grafting in PRP to improve hair, to improve skin, and to improve volume of the face. We can perform it alongside a lip lift, which is a surgical procedure where we shorten the distance from the bottom of the nose to the lip to add a little bit of an extra lip show and to add a little bit of plumpness to the overall shape and design of the lip, but also to improve the tooth show in this area, and that can help de-age the middle of the face. It can also be performed with a chin augmentation to give a really deep jawline in patients that have deficiencies or not a strong chin. So a weekend lift is really a hybrid procedure. We're utilizing the best of many different minimally invasive techniques to give the patient a great look that's going to preserve them and reduce the risk for a need for facelift surgery later on. Most importantly, the recovery time is short. It's really 3 to 5 days. There's no need for an aftercare facility, and they get a really great shape to their neckline after surgery. It's one of my most exciting and fun procedures to perform, and it's really designed again for patients between the ages of 30 and maybe late 40s that have heaviness in the neck, that have issues but are not quite ready for a full facelift yet. If you'd like to learn more, there's lots of pictures and videos on my Instagram, but I'd also like to see you in clinic and talk with you a little bit about the procedure or a virtual consult. I look forward to seeing you in clinic and offering you the weekend lift.